Dr. Beebout here. Let's do our medical word of the day. Today, I am going to do a generalized term that breaks down into some other components, and that term is strabismus. Strabismus means a malalignment of your eyes. Now, this can break down into basically four different kinds. You have esotropia, which is when your eye deviates inward toward your nose. You have exotropia, when your eye deviates outward. You have hypertropia, up, and hypotropia, down. So those are basically the four big kinds of strabismus. They're caused by either a neurologic defect that is altering the innervation of the muscles that align your eye. There are 6 muscles that work in conjunction with each other to align your eye and allow your eye to move in different fields. Sometimes you have a problem with the muscle itself, but a lot of times it's a neurologic issue. You see it a lot in kids. In fact, most babies cannot control their eye movement. Now, they should self-correct as they get older. If it does not correct, there are some things that needs to be done. It can be exercises, it can be refractive lenses, it can be patching an eye to make the other one work the way you should want it to, and it can be as drastic as surgery at times. You could tell sometimes when you look at somebody, when you look at somebody and their eye is sticking way over here, it's pretty obvious. But sometimes you can have an abnormality in the deviation of the eye or a deviation of the eye that's just not as noticeable looking at them. And one of the good ways to tell is to get them in the light. And when the light reflects on the cornea of your eye, it should reflect and you should see the light reflection evenly on the pupil or iris in the same spot. If you've got one lined up here over the pupil, but one is lined up here over the iris, then the eyes aren't lining right, and that is strabismus. So, if you have malaligned eyes and you're having headaches, trouble seeing right, difficulty walking because you can't see right, then you probably need to have it checked out, at least see your eye doctor, or see your primary care doctor to get it diagnosed, and then we can go from there. So there you have our word of the day, strabismus.